So my drug is zidovudine or retrovir. It is a nucleoside reverse transcriptase, and the therapeutic class is antiretrovirals. The mechanism of action, this drug has the ability to incorporate into DNA chains by viral reverse transcriptase. Therefore, it blocks the addition of further nucleotides and terminates viral replication. The question that I had for this drug was, what is reverse transcriptase? And reverse transcriptase is the enzyme needed to change RNA into DNA to be able to replicate, and zidovudine blocks this action, and there's a little picture down at the bottom to kind of show what's going on. Indications for use: it's used for HIV treatment, reduction of transmission to fetus from a pregnant woman who has HIV, and then an off-label use for the drug is post-exposure prophylaxis after occupational exposure. So if you get exposed like at work, then this is what they'll give you. Interactions: other antiretrovirals can create an increased risk of lactic acidosis and hepatomegaly. A couple of other ones that I thought were important: acetaminophen, ganciclovir, and interferon alpha enhance bone marrow suppression. Clozapine increases risk for agranulocytosis. Acyclovir and valacyclovir enhance CNS suppression. And ribavirin can enhance development of anemia. Some adverse effects: there was 2 black box warnings, one for granulocytopenia, aplastic or hemolytic anemia, pancytopenia with bone marrow hypoplasia, leukopenia, and lymphadenopathy. And then the other black box warning was related to lactic acidosis and severe hepatomegaly. If these adverse effects appear, then the drug needs to be immediately discontinued. And then contraindications include a hypersensitivity, history of lactic acidosis, and breastfeeding. It should be used cautiously in patients with anemia, severe hepatic or renal disease. Some education points: teach prevention techniques such as hand washing, being up to date on immunizations, and safe sex practices. These drugs relieve symptoms of HIV and don't cure HIV. Effective treatment is reliant on close adherence to the medication regimen. Do not use herbal treatments while taking antiretroviral drugs. Take medications exactly as prescribed. Do not skip or double doses. Stop taking abruptly or change medications without consulting the provider. Zidovudine can be taken with or without food, and take medication around the clock to maintain therapeutic levels. And then my references are on the back.